Right, let's stay with labour matters now, and trade unions are crying foul over the lack of protective gear for health workers. The National Education, Health and Allied Workers Union, NEHAU, says some of its members have not been given protective gear. The union is now threatening to take legal action to compel the Health Department to comply with the Safety Act of 1993. For more on this, let me take you live now to ENCA's Kaelihle Khumalo, who is tracking that story. So this is a warning from a few days ago, Kaya, but it seems the NEHAU continues to be worried about the safety of its members.
Well, precisely, Tulasiza, because the NEHAU members form a bulk of, the very key essential workers within the very healthcare facilities, the nurses, the doctors, the pharmacists, and many other key essential workers. So they have been making a number of calls to the department to comply with the Safety Act and make sure that all the regulations that have been set aside, guided by the Safety Act of 1993, are being followed upon. But Tulasiza, we're going to speak now to NEHAU's president, that's Mr. Mzandile Magwayiba. So, sir, thank you so much indeed for your time. So now you're looking at the legal option. What is the department saying to you?
We have been trying to be in contact with the Minister of Health, Comrade Mkize. We're not being successful. He's been ignoring us. I'm saying this with the greater respect in the absence of explanation why he does not come back to us. So we have asked our legal team to put together papers and to apply for court agency on the agency basis to compel the state, the government, to comply with the Health and Safety Act, and simply provide our members with what I have on my mouth as we speak, and other necessary safety. This is an old battle with the union, with the Department of Health, for a very, very long time, for many, many years. It's just that now is exposed by coronavirus. Otherwise, it's a matter that we've been fighting for. You can go to Inkosi Hospital, Albert. You will find filing of dispute. You can go everywhere in the province and the country. You will find how we've been fighting for this. Not only this, each and every health facility, each and every building of the state, even if not Department of Health, must have a functioning health and safety. And in the issues of this day where we have outbreak, that health and safety committee should be activated to make sure that all of these things have been done. You must have seen the pension payout in the Eastern Cape, where hundreds of people were queuing for their pension. It is a department that's supposed to provide those old mama and old guys to these, like the one I have, but it's not been done. I thought that we are the stakeholder in the Department of Health. I state that we are a stakeholder in government. We're supposed to have daily briefing meeting with the Minister of Health as union in order to be able to be assistance with government, but it's not forthcoming. We don't know why. So because in KwaZulu-Natal, the members of NEHAU of EMS decided not to work. They were suspended because the masks that I'm wearing were not provided to them.
And maybe just to come in there, Mr. President, do you have a specific date where you're going to court, or that's yet to be determined?
That's still yet to be determined. It's the work of lawyers. Lawyers must know when the date is available. And also, we don't want to delay the matter because we're not intending to do it behind the back of the government. We want to do it, and we wish that immediately they will have answering affidavits so that the matter is not delayed. But our intention is to compel government to provide our members with masks, with all necessary tools to deal with COVID-19. It's not necessarily to fight government. We want, much as we would love to be part and parcel of the government troops to fight the COVID-19, but we find ourselves excluded, not by many words of mouth, by denying our members tools to do exactly that, to deny our members safety regalia that must be able to be used when they're in contact with government. But I also warn the state. I seriously want to warn them, because we will not hesitate to litigate against the state should our members be affected simply because they were instructed to do risky work, knowingly very well that they are not being. We will not only end here on the issue of compelling the state, we will litigate against the state.
All right, so maybe just before we let you go, your members, how are they coping? Because the numbers are rising in South Africa in terms of the cases, but just quickly, how are they coping in our facilities?
It's difficult. It's difficult. We've been waiting for COSATU to facilitate the permit for us as leadership of the union, particularly 6 of us, to go different sides so that we can assess and so that we can give pad on our members to motivate them, to tell them that you're not only fighting as part of your job, but you're fighting to defend the nation. So it's difficult, but what else can we do? They are coping. I was then saying that our members in KwaZulu-Natal were suspended through the intervention of the chief negotiator of Department of Health. Those suspensions were lifted. This happened exactly simple because they were demanding the safely geared to go and work, like mask, soap, gloves, protective clothing in general, which Department of Health by nature of its work must provide. It's a matter that should be in their budget. I cannot comprehend why a government will get masks from China embassy, not having it in their cupboard. I can't understand that.
All right, Mr. President, thank you so much for your time. So there you have it, Thulasizwe. So it's a litany of demands from the side of Nehawu. They are making quite a good appeal to government to make sure that they procure the medical supplies, but also the protective gear for their members, who are really just a bulk of the healthcare workers in the facilities.
Kaedehle Khumalo, thank you for that update from Bedford View here in Johannesburg. And it's a critical conversation about the protective gear for health workers, Dumi, because part of the complexion of this COVID-19 is that in parts of the world, healthcare workers who are at the front line of responding, a number of them, an unacceptably high number of them, actually contracted the virus while at it, without prejudging the merits in this particular case, whether or not enough has been supplied, and I think the Minister of Health and Government will be able to clarify there. But it's absolutely critical that we protect our healthcare workers because we still expect them to be the frontline people in responding.
I mean, if I remember clearly, you know, the numbers when we're tracking them, we had a total of 13 health workers who had contracted COVID-19, even though, of course, the department said that it was not from health workers, you know, working with patients that had contracted it elsewhere. But we know that 11 of those were medical doctors, and actually a 70-year-old medical doctor who was also in ICU. So we know that they are compromised. But also, I think the health department needs to take this seriously, especially if the union is saying that they will, of course, have to compel themselves to a legal process should they not come to a party, because people's lives are at risk, their members' lives are at risk.